So 3 big secrets about thyroid disorders. I've presented on this topic multiple times. I've changed the name multiple times, but all the concepts are the same. There's a huge need in healthcare for this information. We spend 90% of our marketing on thyroid education and acquiring thyroid clients and patients because many go improperly diagnosed or improperly managed and continue to suffer with chronic symptoms, even if they already have a specialist, an endocrinologist, even if they're already on medication, and they continue to suffer and they don't know why and they can't find answers. And this is why I do this, and it's very important. So I imagine most of you are here because you either have a thyroid condition or a family member or loved one has a thyroid condition. Maybe you've experienced something similar going through the conventional medical system and are looking for answers or are looking for an alternate route, right? So let's get into it. My name is Dr. Ernesto Medina, founder of 4 Healing Health and Wellness Center in Round Rock, Texas. Website is 4healinghealth.com. You can check out our website there. Do have a lot of additional free information in there, and as well as recordings of our past webinars that I've done. Did one on brain fog, did another one on holistic approaches to mental health, which is a very popular topic. And next month we'll be doing blood sugar, insulin resistance, and prediabetes. Okay. All right. So let's get into a quick disclaimer. Information is not intended to treat or diagnose any condition. This information is just for educational purposes. Always consult with your primary care or your own healthcare provider before starting any kind of other intervention. Every case is unique and different. And a lot of the topics I'll talk about are general overview topics. But like you're going to realize, a lot of what I talk about is not something that's typically talked about in the conventional medical model or the conventional medical paradigm. And so it'll be new information, sometimes shocking information. And so really meeting one-on-one with me will allow me to have a better understanding of your personal needs, personal health goals, and how we would go about addressing those issues. So the thyroid gland, major hormone producing gland. So it falls under the specialty of endocrinology. That's why endocrinologists typically manage thyroid conditions, if it's not your primary care. And it is so important because all cells of the body have receptors for thyroid hormone, all cells of the body. So a dysfunctional thyroid can cause any number of symptoms anywhere in the body, right? Anything from poor digestion, to acid reflux, to constipation, to diarrhea, to poor bone formation, causing osteoporosis or osteopenia, hair loss, hair thinning, nail thinning, weak and brittle nails, right? It's all over the map. So oftentimes it's frustrating to have a thyroid condition because of the symptoms you experience. But it's also difficult sometimes to get a proper diagnosis for what you're experiencing because the symptoms can be so different across the board. So what is the problem? Why do I dedicate so much time to educating people on the topic? And why do so many people go mismanaged? Well, it is probably the most poorly managed organ system in conventional medicine due to the poor standard of care. Okay, and we'll talk a little bit more about standard of care and what that is and how it has not changed in over 20 years. But it is estimated that 50% of people with thyroid conditions go undiagnosed. And my 2 cents from that is many more go misdiagnosed. 75% of thyroid conditions are found in women, right? So about 1 in 8 women suffers from a thyroid condition. But remember, 50% of cases go undiagnosed. So really, that's like 1 in 4 women that suffer from thyroid conditions. It is very much predominantly in women. So here are some of the most common symptoms of a low functioning thyroid or an underactive thyroid, also called hypothyroidism. Dry, brittle hair, hair loss, chronic fatigue, uncontrolled waking, chronic aches and pains, Low energy, chronic fatigue, brain fog, poor focus and concentration, depression, anxiety. I spoke quite a bit about this in the mental health, holistic approaches to mental health webinar that I did. And so the symptoms, like I said, can be all over the map. And so why does the issue exist? Why do so many women suffer from it? And why is it so mismanaged? Well, our tip number one that's keeping you sick and unhealthy is that the medical standard for assessing and treating thyroid function is grossly ineffective and incomplete. It's as simple as that. The medical standard of care, which means the bare minimum a doctor must perform to not be considered negligent, is just that. It's the bare minimum. It's not going above and beyond to really, truly investigate into what is driving. First of all, do you have an underlying thyroid condition, and what is driving that thyroid condition for you? Standard testing in the United States is typically only measuring your TSH levels. Occasionally, you'll find a doctor that'll also order your T4 free levels. And even more rare is to find a doctor that will test your T3 levels. All of those are important, but really, there's about, 8 or 9 markers on a thyroid blood test that should be evaluated to properly know if you're suffering from a thyroid condition or not, and whether your medication is working effectively or not. The other big issue with the standard of care is that the range for TSH, which is typically the marker that's used to decide whether you have a thyroid condition or not, the standard range of TSH is way too big, too wide. The range on a lab typically will be around 0.4 all the way to 5.0, which in the world of hormones is humongous of a range. So you could test at a level of 0.5 and be told, no, your thyroid is fine. Your symptoms, your chronic symptoms you're experiencing are not thyroid related. Or you can have a level of TSH of 4.99. And again, you're told, no, your thyroid is normal. There's nothing we should do, nothing we can do. We shouldn't investigate any further. Just leave it alone. And that is absolutely not the case. In fact, the American Association of Clinical Endocrinologists back in 2001 made a public statement stating that TSH levels are too wide and they should be narrowed. They should be more strict because it is common to find people who are in the outlying ranges of normal, either high or low, and they will suffer from chronic thyroid symptoms, but they're not being diagnosed. Okay, so that's one of the big issues we got going on. This here is the full thyroid panel, like I discussed. These all should be measured periodically to check your status of your thyroid and how it's progressing over time. You can see we have a lot more markers than what's typical standard, right? And I have there in bold what's standard, TSH, sometimes T4 free. And that's usually where it stops. I would say 95% of healthcare providers in the United States, that's where they stop. But we have a number of other markers that should be evaluated. I'm going to dive a little deeper into these, but this is essentially what we order in our office at first assessment for anybody who thinks they might be struggling with a thyroid condition or has been diagnosed with a thyroid condition, but continues to suffer with symptoms, even though they're told their labs are normal. Essential tip number 2, there are 24 different causes of a low-functioning thyroid. Commonly prescribed medications only address one of those 24 variables, of those 24 causes. This is crazy because if there are 24 different causes and medication addresses one of those 24, you're left with a possibility of 23 other causes that medication is not going to fix, right? So what I want to do is I want to take you quickly through a general overview of how the thyroid works. Now, this is something I do with all patients that come in or all new clients that come in for an initial consultation and just have a bunch of questions. They don't understand why, what's going on, why they're not being managed correctly, or why they continue to have symptoms. And it is proved very valuable for most people to understand this concept. So first thing you have to know is all thyroid function starts in the brain. The brain sends a signal out to the thyroid to turn on or turn off, to ramp up or ramp down. That signal that gets sent out is TSH. Okay, that's typically what's measured. Once the thyroid becomes activated, turned on, it creates thyroid hormone called T4. But T4 is an inactive hormone. So we could argue that we really need to measure the active hormone, which is T3. And again, this is T4 total, not T4 free, and this is T3 total, not T3 free. And so if T3 is the active form, we could argue that that's almost the more important one to check, because that is what binds to cell receptors and activates cells the way they're supposed to. But what happens is this is rarely checked because the majority of medications that you get prescribed for thyroid, so thyroid replacement, are T4 replacements. They're synthetic T4. And regardless of what T3 levels are, treatment oftentimes doesn't change. So if treatment doesn't change, and then insurance oftentimes will fight paying for the T3, it has become the standard across the board to just measure TSH and sometimes T4, and that's it. Okay, so that's the big problem there. The reason we care about T3 levels is because the body is supposed to naturally convert T4 into T3. And it does this, 60% is reliant on a healthy liver, 20% is reliant on a healthy gut microbiome. So the bacteria in the intestines is what helps convert that additional 20%. And then the last 20% is done free floating in the bloodstream. So if we just take the first two organ systems, that gives us 80% of healthy T4 to T3 conversion is dependent on a healthy, thriving digestive system. Okay, 80%, because the liver is part of the digestive tract and the intestines are part of the digestive tract. So 80% of healthy thyroid hormone and thyroid function is dependent on the healthy digestive tract. And how do we have a healthy digestive tract? What determines the health of our digestive tract? Well, the foods we decide to put into that digestive tract, right? If we eat pro-inflammatory foods, that inflammation is going to drive down regulation of thyroid hormones and the thyroid in general. If we eat anti-inflammatory foods, they positively influence not only natural thyroid conversion, but also the medications you take. If you're on a T4 replacement like levothyroxine or Synthroid or whatever it may be, it still has to be converted and activated through the digestive tract. The better, more healthy digestive tract you have, the more efficiently medication is going to work. Now, the next step to this, it gets a little trickier here. I'll go back and forth so you can see what changed. T4 can, in one step, revert back into an inactive form called RT3 or reverse T3. This is an inactive hormone. This step is not really supposed to happen, but it can happen. And the primary driver of this is oftentimes inflammation and dysglycemia or blood sugar instability, meaning chronically high blood sugar, being insulin resistant or pre-diabetic or diabetic, or chronic low blood sugar, so being hypoglycemic. Both can be drivers of this. And then the next step to here, the T3, once it's activated, we can measure something called T3U or T3 uptake. This tells us how much of this active T3 is actually binding to cell receptors and being absorbed. Okay, so we could even argue this is equally as important as the T3, because if we're converting fine, but that T3 that's active and converted isn't binding and being absorbed, you can still have thyroid symptoms. Now, the biggest driver of your T3 uptake being low, meaning that T3 is not being absorbed into your cells, is largely too much estrogen buildup in the bloodstream, right? So this is largely women. And I've got a couple questions coming in. Great. So estrogen can block T3 uptake. So I often see this it's possible in women on hormone replacement therapy, especially estrogen replacements, but it's a lot more common in young women on birth control, especially estrogen-based birth control like the pill. This is a perfect example of someone who could have a thyroid condition secondary to estrogen buildup in the bloodstream or estrogen dominance due to their birth control, right? If this is never checked, that's never discovered, and someone could be medicated for a hypothyroid condition, that T3 becomes activated but never actually absorbs and binds, and they continue to suffer with symptoms even though they're being managed, quote unquote, appropriately based on the standard of care. Now, to summarize that, the other 23 causes of a thyroid condition are due to chronic systemic inflammation. We spoke about that, especially coming from the digestive tract. Too many stress hormones. That's a combination of cortisol and adrenaline, epinephrine and norepinephrine. And the biggest driver of those stress hormones being released is actually not really stress, but physiological stress from unstable blood sugar or from overtraining. So I not too often, but I see some individuals, largely women, who overexercise and undereat, and they're putting their body in a state of physiological stress. That increases the release of cortisol and adrenaline. I also see it in women who undereat calories each day. That again puts the body in a physiological state of stress. So nutrition is extremely important for addressing both the chronic systemic inflammation as well as managing stress and stress hormones. The next bullet point, testosterone and estrogen imbalance. We spoke about birth control. To a lesser degree, there are a number of cosmetics that are considered xenoestrogens that mimic and bind to estrogen receptors in the body. That can be lotions and creams and makeups. There's a website called EWG.org, stands for Environmental Working Group, and they've done studies testing different products, and they give them a grade from A to F based on cleanliness and potential for causing harm or being toxic. So you can always check that out and check out your products. High grain, carbohydrate, and high sugar diets, where you spoke about dysglycemia and being insulin resistant, pre-diabetic, or having chronically low blood sugar. Nutrient and vitamin deficiencies, serotonin and dopamine imbalances in the brain, because remember, all thyroid function does begin in the brain. If you have an unhealthy brain, you can have a lack of activation of the thyroid. And I spoke quite a bit about healthy brain and steps to having a healthy brain in my brain fog, beating brain fog webinar, which you can find on YouTube if you look up my name. A bad digestive system, that includes intestines, liver, and also the gallbladder, which is part of the digestive system. And then autoimmunity or an autoimmune disease causing your thyroid condition. Okay. Now, essential tip number 3, we're going to expand on that autoimmunity part. 80 to 90% of all underactive thyroid conditions are due to an autoimmune reaction attacking the thyroid called Hashimoto's. Very important. So this is not a faulty thyroid, but a faulty immune system that is attacking your thyroid, causing the thyroid hormone imbalances. This is a very important concept because many people do not get tested for Hashimoto's. And the reason they don't is, one, insurance will often fight over paying for it. But number 2, again, treatment does not change in the conventional medical model. And so you will still get some sort of T4 synthetic replacement, and they'll gauge your response by measuring your TSH, but nothing is done about this autoimmune attack of the thyroid. So it's completely ignored most of the time. Management strategies must be aimed at balancing the immune system, not just medicating the thyroid. And your antibodies that tell you whether you have Hashimoto's are called thyroid peroxidase antibody and thyroglobulin antibody. These are part of our 8 marker checklist that we screen on everybody. Now, I'll talk quickly about hyperthyroidism. The number one cause of hyperthyroidism, which is an overactive thyroid, is Graves' disease, which is another autoimmune condition. I have had a number of people come in being told they have hyperthyroidism, an overactive thyroid, because their TSH levels are at that level that signifies they're hyperthyroid, but they have not been checked for Graves' disease. They have not been checked for that antibody. And when we run the antibody test to confirm Graves' disease, it comes back negative. Now, how does this happen? Well, Hashimoto's, this autoimmune attack, occasionally will flare up. And when it flares up, it causes a massive, immediate destruction of the thyroid gland, which leaks excessive amounts of thyroid hormone, pushing you temporarily into a state of hyperthyroid when you've traditionally been in a state of hypothyroid. Okay. And so it gets, and once this is confirmed or denied, right? Once we know that Graves is not the issue and Hashimoto's is, it gets addressed the same way, right? The autoimmune inflammatory component must be addressed to improve overall balance of the thyroid. So in our diagram here that I've already gone through with you, all I've done here is added the extra step here in purple, saying that the immune system now is an added variable in this diagram, and the immune system attacks and destroys the thyroid, causing downregulation downstream of your T4, T3 numbers. Okay, the main driver of this is, again, inflammation. And you can see at the very top there, I have inflammation in a box in orange, because like I mentioned, an inflamed brain can also cause downregulation of thyroid and thyroid production. And pop quiz, what are the main ways to control for inflammation and the inflammatory response of the immune system? Your nutrition, the foods you decide to put into your digestive tract or avoid. So the focus has to be balancing the immune system, identifying inflammatory foods, and that list, there is some variability among people. Some people can have immune reactions to foods that others don't. We go through a process of elimination with all of our new patients to try to identify those. Regulating the immune system with targeted supplements, and there's a number of supplements that help do that. Anything from vitamin D is very important, omega-3 fish oils, probiotics, prebiotics, prebiotic fibers, turmeric, resveratrol, green tea extract, right? There's a number. N-acetylcysteine, glutathione, right? There's a number of those. Usually based on each individual case, we'll give a different set of recommendations based off need, but the number one by far is going to be vitamin D. It is the number one vitamin deficiency in Americans, and it plays a role in multiple systems, not even bone health, but immune system regulation and controlling inflammation and supporting hormones. So it is very important. Healing the digestive system, right? Remember, we spoke about how the digestive system is very important for converting T4 into T3 hormones. Exercise is vitally important for healthy blood flow and circulation to the brain. We spoke a lot about that in the brain fog course, as well as the mental health course, right? If the brain is inflamed and not working appropriately, that can be another secondary cause of poor thyroid function. And then managing psychological, emotional, and physical stress. How do we manage, just to recap, how do we manage physiological stress? Well, number one is going to be making sure we're eating enough healthy protein and fat. Because if we're under eating calories and we're expending way more than we're eating through the day, our body eventually goes into a state of starvation and stress and secretes cortisol and all these pro-inflammatory components like excess adrenaline when it's not needed. So the take-home message to wrap up before I get to questions, and remember, if you do have questions, feel free to post them in the chat, and I'll get to them here shortly. Take-home message to wrap up here is proper thyroid function is dependent on a complex interaction between your brain, so a healthy brain is very important, your thyroid gland, your digestive tract, especially for controlling inflammation and for the healthy conversion of T4 to T3, and your immune system in cases of Hashimoto's and Graves' disease. There are over 20 different causes of an underactive thyroid condition, and medication addresses only one of those. Up to 90% of underactive thyroid conditions are due to an autoimmune dysfunction, an autoimmune disease, right? That's your Hashimoto's for hypothyroidism or Graves' disease for your hyperthyroidism. And the Graves' disease, it's a lot less common, so I spend less time talking about it. The Hashimoto's and hypothyroidism is much, much more common. The stress you experience, cosmetics you use, foods you eat, and medications you take can all influence the function of your thyroid and your hormones. So our special offer for those of you, I see some familiar names in the group, but those of you who have never visited us before are looking to get a more detailed analysis or even just a more detailed one-on-one conversation with myself, we do offer free 30-minute consultations. You can text the word thyroid to this number. You can write it down. You can take a snapshot of this picture, 512-641-4500. Text the word thyroid to this number, and tomorrow morning my front desk will get back to you and set you up for that free 30-minute consultation. If you have copies of old lab work or even recent lab work that another doctor ordered for you, you can bring those with you. We can sit down and take a look at them, discuss what was ordered, what wasn't ordered, and talk about getting some additional testing if you need it. Okay. You can follow my Instagram, my TikTok. I post a lot of free educational material, especially a lot of interesting cases that come into the office. I keep it all anonymous, but a lot of it is largely educational. And like I said, you can look up my YouTube channel, just look up my name, and you'll see a number of past webinars we've done. All right, so let's take a look here. So we've got a question. Can you briefly mention some things to avoid in skincare products that might impact thyroid function? Oof, there are so many. So phthalates and parabens are commonly found in skincare products. Like I mentioned, I'll put it in the chat, ewg.org is a website where you can go and do some more of your own research, look up your own products and see what you have, how they're graded, if they're there. But parabens, phthalates, titanium dioxide is a common one I was just reading about that's found in some skincare products that has some links to carcinogens, right? And a lot of these products will be listed as possibly carcinogenic, meaning it causes cancer, but it says possibly because not enough research and money has been put into really investigating it. And that's because the FDA and the other regulatory government bodies just, there's too many chemicals for them to study, right? There's over 80,000 chemicals that are allowed on the market that don't really have any deep research on whether they're carcinogenic or not. So those are the common ones. The other question here is, should these tests be done yearly as part of a physical, or do I wait for symptoms? I would I would say done yearly as part of a physical is best. Sometimes thyroid conditions can come out later in life. Definitely, we don't like to wait for symptoms. We like to be proactive and preventative versus reactive and wait till late stage. So yeah, if you've never had a full thyroid panel done and you've been told you have a thyroid condition and you continue to experience symptoms, you really should have a detailed look and a detailed blood test done. I do include it as part of my physical for patients who come in, even if they have other complaints. If they remember, thyroid hormones interact with every system of the body. So if someone comes in with complaints of fatigue or chronic constipation, right? I don't know, is that chronic constipation just their gut is inflamed or is it secondary to a thyroid condition, right? I don't know unless I check. And so I do include it as part of a yearly physical, that full detailed panel. All right. All right. Thank you very much. Doesn't look like there's any other questions. Right at 33 minutes. So made good time. Again, thank you everyone for joining. I don't want to take up your time. I want to value your time and your family time and dinner time. If you do have interest in the free thyroid consultation, please do text in the word thyroid to the number. Again, 512-641-4500. You can always go to our website and send us an email as well through the website. Just mention that you were on the webinar and you're interested in this offer. Next month, I believe we're talking about blood sugar, insulin resistance, and prediabetes. Again, it's not, this topic is also a very important topic because it's often an underlying contributor to thyroid symptoms. Now, here's another side point on thyroid is maybe 30-40% of the time, I'll have a new patient come in with a diagnosed thyroid condition on medication, has all the symptoms. We do the full thyroid panel and it all looks good. It looks normal. Well, now what? Well, blood sugar issues often mimic a lot of the same thyroid symptoms. And so we have a pretty detailed questionnaire that we have everyone fill out when they first come to visit us. And if I see many blood sugar signs and symptoms on the questionnaire and many thyroid signs and symptoms, more often than not, the blood sugar issues are contributing to the thyroid symptoms. We always check, we'll do a blood test and check. And if thyroid hormones are fine and in balance, 100% we focus on blood sugar. So that's going to be spoken about in detail at our next webinar. So don't miss it. All right. Thank you very much, everyone. Have a good night. Thank you for joining.